Dear students, hello, how do you do? Dr. Ashok Kumar Rana, MD Medicine. Uh, the topic in medicine today for BDS final year and MBBS students is sinus bradycardia. Now, what is sinus bradycardia? This is a very important viva question and a short question. Sinus bradycardia means the retardation of heart rate. Now, for this, you will know or you should know the normal heart rate. Only then you can judge or you can say or assess that this patient has low heart rate or this patient has high heart rate. So sinus bradycardia is heart rate when it is low than the normal. Now what is the normal heart rate? Normal heart rate is 60 to 90 beats per minute. This is the normal heart rate range, 60 to 90 beats per minute. Now what happens in sinus bradycardia? This heart rate gets low than 60. So definition becomes when the heart rate is less than 60 beats per minute and it is regular, then it is called sinus bradycardia. So sinus bradycardia is highly important to diagnose because sometimes if the heart rate gets very low, maybe below 40, then it may lead to cardiac standstill. Especially it is true in patients who are having some organic or pathological disease of the heart. So इन conditions में आपको heart rate का ध्यान रखना पड़ेगा. Now before going further, I will request you to go to my app Dr. Ashok Kumar Rana and from the Google Play Store download it and you will have this content and other contents related to cardiology. So coming back to the topic of sinus bradycardia. Now coming to the what are the various causes of sinus bradycardia? Sinus bradycardia has been divided or classified into two causes. That is, one is physiological and another is pathological. So two types of causes, physiological and pathological. Physiological means when the patient is not having any type of disease, it is only because of his profession or because of his body system. So number one cause of physiological bradycardia is exercise. That means as it happens in athletes, the persons who are sports persons, they have their heart rate less than 60. Second cause is during sleep. जैसे पेशेंट सो रहा है, कोई भी सो रहा है, तो उसका हार्ट ड्यूरिंग स्लीप उसका 60 से कम हो सकता है. So that is a bit normal phenomenon that is called physiological sinus bradycardia. Now second is pathological. When the bradycardia is because of certain diseases. So first important disease is hypothyroidism. This is thyroid gland which is present in the anterior part of the neck. So when this gland is not functioning to normalcy, that condition is known as hypothyroidism. So first is hypothyroidism. Now this condition is very important cause of bradycardia. Second Pathological cause, raised intracranial pressure. Now there is pressure of the brain, CSF pressure is there, that is called intracranial pressure. It is measured in water, 50 to 80 millimeter of water. Now this pressure, when it is raised due to various conditions like infections, meningitis and encephalitis, number 2 hemorrhage, number 2 bleeding in the ventricles, then tumor, then encephalopathy. So all these conditions which lead to raised intracranial pressure come under raised ICP, and they lead to sinus bradycardia. So second important cause is raised intracranial pressure. Other signs are also present of raised intracranial pressure like vomiting, severe headache and giddiness. Vomiting is very important, that is projectile vomiting, जैसे patient बैठा है एकदम उल्टी आ रही. Third cause is obstructive jaundice. Third cause of bradycardia, that is pathological bradycardia, is sinus bradycardia, is obstructive jaundice, as may occur in viral hepatitis, alcoholic hepatitis, portal hypertension, etc. etc. So many causes. Then fourth cause is sick sinus syndrome. This is disease of the SNO, sick sinus syndrome. Then the fifth cause is hypovolemia or hypothermia and hypovolemia. Hypothermia. It is hypothermia, not hypovolemia. Hypothermia means when the temperature of the body comes down to less than 36, 35, 34 डिग्री सेंटीग्रेड, उस पेशेंट का फिर जो हार्ट रेट है वो ब्रेडिकार्डिया होता है, लेस देन 60 पर मिनट हो जाता है. एंड देन लास्ट वन इम्पॉर्टेंट कॉज ऑफ साइनस ब्रेडिकार्डिया इज ड्रग इंड्यूस्ड. Drug induced. Now as you know, various drugs like beta blockers, metoprolol, propranolol, atenolol, etc. Then digoxin. Now these beta blockers are used for hypertension, for coronary artery disease patients, and digoxin is used for patients of congestive heart failure having atrial fibrillation. In the past it was used very frequently, but nowadays it is not frequently used. Then third drug can be calcium channel blocker, CCB, especially verapamil and diltiazem. So these are drugs which may lead to sinus bradycardia. Now, what can be the treatment of sinus bradycardia? It depends upon the cause. If it is physiological, nothing is to be done. But if it is pathological, then we have to first investigate the patient and find out the cause. Suppose if it is hypothyroidism, treat hypothyroidism. If it is raised intracranial pressure, treatment of that condition which leads to a raised intracranial pressure. Similarly, if there is obstructive jaundice, then it can be the treatment of obstructive jaundice. Now, if in patients of sick sinus syndrome, the treatment of choice is permanent pacemaker, because it is a case of tachybrady syndrome. That means sometimes patient is having tachycardia, sometimes bradycardia. So in those cases, it is permanent pacemaker which is to be given. Permanent pacemaker is to be applied by a cardiologist at a higher center in cardiac cath lab. And for immediate treatment, injection atropine may have to be used if it occurs in patients of cardiac infarction. So sometimes liquids may cause a cord. Sometimes in patients of inferior wall myocardial infarction, there may be bradycardia because of involvement of the right coronary artery which is supplying the SA node. So that may need patients injection atropine, and sometimes we may have to do electrocardioversion. So these are some important treatment measures, and then सबसे important है causes. So keeping in view this short topic, and it's a very important viva question, it's very important short note, it's very important in your NEET examination also. So wishing you all the best, and again requesting you to like this video, share with your friends, and join me at क्लास प्लस ऐप गूगल प्ले स्टोर से डाउनलोड करके मेरी क्लास प्लस ऐप को आप परचेज कर सकते हैं. वहाँ से आपको बहुत सारा मटेरियल मिलेगा. एंड विद दीज वर्ड्स आई विल आस्क यू टू look for this video properly, and any comments, if you have any difficulty in understanding, you can put in comment box. I will try to reply it in time. Thank you.